And she just started to cry. And she said, I can tell this has made such a difference. I said, you can? She said, yeah, maybe not everybody can, but I know him.
But he said, before I did neurofeedback, I thought I was a monster because I did bad things and I didn't know why I did it. Neurofeedback changed my life.
Welcome everybody back to Real Brain Talk with Dr. Guy and Dr. Ken. We're here with a dynamic duo, really, because this is really one of the most dynamic brain core offices we have from the great state of Texas, right? We've got Dr. Agnes Kaufman and Dawn Kuhn.
Hello.
Hi.
Welcome. Really happy to have you.
Yeah,
So thanks for having us. Yeah.
Dr. Kaufman, you've been a brain core practitioner for quite a while now, and I'd be curious to know what got you started. What made you curious about neurofeedback? What made you think about adding it to a chiropractic practice?
I originally became interested in neurofeedback therapy after my mom passed from Alzheimer's. My mom was one of 4 children that had it, and my parents had 9 children. So after my mom passed from it, I started thinking, okay, that was 25% of her family that got it. Does that mean 25% of our family is going to get it? Am I going to full on get it? Am I going to get it a little bit? And so I just started researching like natural brain treatments. Being a chiropractor, right? I went for what can we do naturally for the brain? And I stumbled across neurofeedback and I started reading about it. And I'm like, wow, this is really interesting, but it sounds a little bit too good to be true. You watch TV and your brain gets better.
Yeah.
The boob tube.
Yeah. That's not the story we were told when we were kids, right?
For you. And so fast forward, I moved to Texas and I started working for Sandstone Chiropractic. So I started working temporarily. And then after Dr. Lindsay had her baby, Dr. Tony was like, oh, I just got this neurofeedback equipment. And I'm like, what? You're kidding. It was like one of those God moments almost, like where the meat came down. It's like, I'm so interested in that. And he's like, yeah, I've been hearing a lot of good things about it. And he's like, hey, why don't we beta test it in one of the chiropractic offices for 18 months and see what happens? We just saw some amazing results. And so then Dr. Tony said, you know what, I think this is a standalone, therapy. And I think, you would be great to head up the neurofeedback office. And so we opened about 8 years ago. And here we are.
Here we are.
Dawn has a pretty compelling story too, because her 2 sons were some of the first clients that we had when the clinic opened.
Yeah, when the clinic branched off, I think they were 75 and 76 or something like that.
Patient numbers.
Yeah.
Dawn, how long have you been with Dr. Kaufman?
Well, I mean, she treated my kids. We did neurofeedback 7 years ago. And I say I sort of never left, but I've actually been an employee now for 4 years. Just have my 4 years. But we stay in touch in between. And when neurofeedback practitioners touch your life, especially from a mom perspective, and help improve your kids' quality of life, they're family. They really become family. No other doctor or practitioner we had worked with had impacted my kids' quality of life like neurofeedback did. So we stayed in touch. I came to her one day and I had written up a job description. I said, you should hire me to do this.
I love that.
And so she did. So I still am allowed to do some advocacy work. We do quite a bit of work in the community on some task forces. I get to go to Austin and work on some bills and all that kind of stuff. So it's been a great friendship and relationship, but she has had one of the biggest impacts on my kids' lives of anybody.
Can you tell us a little more about that story? I'd be curious to hear.
So my 2 boys are adopted. They're biological brothers, but they're adopted. So they both have a whole host of mental health issues in their DNA. We took custody, one at 15 months, and 3 weeks later, the other one was born. So I went from 1 to 2 in 3 weeks. At first, I was like, well, this is okay because that other one just sleeps all the time. But then when they both started moving, it was a whole new ball of wax. And we adopted through CPS. So you're kind of, trained when you're going through the certification process to become a foster parent, that these kids are probably going to have a lot of issues. They are really proponents of medication. They pretty much tell you you're going to have to medicate your kids to have any kind of quality of life.
Wow.
They actually say that?
Pretty much. Yeah.
Wow.
And,
Yeah,
and that's
for
I
me,
had no
do they
idea.
mean that for you to have a quality of life or for them to have a
no,
quality
for
of
the
life?
kids.
For them,
They're warning you that the kids are coming. And I don't want to get in, trouble here.
they're
On the
basically saying that if you want your kid to have a good quality of life, they have to be on this medication.
that the chances are they probably will have to be medicated because they're going to come with
Wow.
mental health issues. And so never ever heard of neurofeedback, never heard, back then I didn't know anything. Right. So we were on so many different medications, and then this one causes the side effect. Then you go on this one to combat that one. And then this one makes you gain weight. So you go on this one. We had been on probably over 10 between the two of them off and on. When we came to Sandstone, we were on 4 different medications between them. And by the time our neuro was done, they were on 0. And they never
Wow.
went back on any of those medications ever.
Can I ask you a quick question? I know you said they had mental health issues and they were on a lot of meds for those issues. What can you be more specific as far as like what the issues were? Was it focus, anxiety?
Yeah. So
what kind of things were they experiencing?
my oldest one, it has some pretty severe depression, a major depressive disorder, also has a borderline personality disorder, but we were not treating that back at that time. He was having seizures, so epileptiform seizures. So not the flail on the ground, but the blinking. We didn't even know he was having seizures. We finally went to a clinic that diagnosed that, and they were actually the ones that said you should try neurofeedback. And they just Googled the one that was closest to me, and that happened to be Sandstone. So that's how I stumbled into Sandstone in the beginning. My other son is on the spectrum, so he has autism, very high functioning. He had been misdiagnosed as ADHD, but turns out he doesn't have ADHD. They were misdiagnosed at least 12,000 times throughout our journey. But very, very high functioning. His issue was really more the social anxiety. So when I met Dr. Agnes, I was homeschooling because he could not take the classroom. They would call me 2 or 3 times a week. He'd be in a fetal position in the corner, sobbing.
Sensory overload.
Yeah. Not because of the academics, but because of the 20
noise
people
and
that were- Yes. So I was homeschooling at my wit's end, had been one of those moms that had tried everything. I went down the med road. I drank the Kool-Aid. We had done a lot of therapy. It was great, but it wasn't addressing the root cause, of course. And I'm a big proponent of therapy. I'll never be without a therapist, but it doesn't address the root cause, right?
100% with you. Yep.
Yeah. So, and they were just really, really struggling. It was a tough time. So we landed here through a recommendation from the PMP Center in Dallas. And so that's kind of how our neurofeedback journey began. I was totally skeptical. In fact, when I filled out the paperwork, I purposely put like 1-word answers because I just thought this was all hocus pocus, fairy dust junk. And I thought if I gave a lot of details in the intake paperwork, she would just kind of regurgitate it all back to me. So I purposely was vague, really, really skeptical. But then I went to the report and with my husband, and it felt like she lived in our house. We had a lot of things going on at home that we weren't even talking to our family about. One of my sons had some pretty violent tendencies, and we weren't really talking about that. And I certainly wasn't putting it on intake paperwork. But when she went over the report, I was like, oh my gosh, like, does she have cameras set up in our house? Like, how does she know? And so then I was sold, like we had to do it because there's no way that she could read my kids like a book without there being something, to these patterns and everything else that she was talking about.
It's a pretty amazing, isn't it, how accurate the brainwave patterns are? Like we hear that time and time again where somebody's like, you describe them based on the brain map and they're like, oh my God, that's me.
I felt so guilty that I had medicated them for 5 years. Lord only knows what kind of damage that did. But, I think we still would have been homeschooling with my kid in the corner, on medication if it were not for neurofeedback. And when we were done with neurofeedback, not only were they off all their meds, but he said, you know what, Mom, I got this. I don't feel as anxious anymore. He said, I still had that little butterfly in my tummy about going to school, but I know I can do this. I didn't send him back to big, hairy public school. I put him in a smaller private school. But yeah, I mean, and he rocked it.
Excelled.
He excelled. He started driving. He drives himself to school. He graduated straight A's. Day-to-day functioning, his quality of life is a lot better. It takes something huge, like a final job interview or something, to even show any anxiety. He's got friends.
Well, a normal amount of anxiousness, I mean, it happens in life, right? I mean, we all experience that. It's about getting stuck in it and not being able to shift out of that gear.
Exactly. Yeah, anxiety is actually not a bad thing. It's a protective mechanism, and it's pretty normal for people to have anxiety around certain events that, but like Ken said, when you get stuck in it, that's when it becomes a problem.
We try and talk about that a lot in our clinic. I think we really pride ourselves is the right word, but we really try to really be, honest and upfront about everything about the process. By the time parents get to us, often it is that last ditch resort, right? They've tried everything else and
Yeah.
how they found us. And so they want it fixed. They want us to fix the autism or fix the ADHD. Can't do that. It's not a cure. So we talk a lot about that, you're still going to have all these emotions. They're normal human emotions. They're healthy for you, much like you just mentioned. But we talk about, if we can get those symptoms in a more manageable level, then that's a huge quality of life.
Yeah, just
improvement. And to
improving
us,
the
that's
quality of
Big
life.
win.
I mean, that's really what it comes down
Exactly.
to, and I've seen, and guys talked about this before too. I mean, I've had cases that were on the spectrum that, what an observer would think there's no change, but what the family sees is incredible change in just the slightest behavior change. The ability to look up and take a family photo and actually look at the camera, or to
Right.
be called from another room and come where they never did that. I mean, these parents were absolutely thrilled at these,
Yes.
what we would think maybe is small, but is huge
Yeah.
change for them.
We had one little guy that was on the spectrum, and he was very sensitive to smell, and he couldn't eat in the school cafeteria because of all the smells. He couldn't eat with the family because the smell of the food was overwhelming. And to the mom, meal sharing is such an integral part to family life. And she's just like, if nothing else comes of this therapy, if he's able to tolerate smell and be able to eat with the family, I don't care so much about the
Yeah,
cafeteria.
right. Yeah.
Nice if it happened
Mhm.
there, but if it happens with the family, this therapy was a success, and it did. And, not only that, but he started initiating play with his little brother, and he had never done that before. Did he still have autism? He absolutely did. But was his family life quality much better? Absolutely.
It's so interesting. We go over our goals with our patients before we begin. And, we had one case, an autism case, where the mother basically said, listen, I just want to be able to hug my kid. He had a sensitivity to touch, and he didn't like to be touched at all. I think we did 15 or 16 sessions of neurofeedback training. And she came in one day just bawling her eyes out. And she looked at me and she's like, yesterday he came in the bedroom and he laid on the bed and he asked me to massage his back. And she goes, I was massaging his back, just crying my eyes out, because it was like the first time that she really touched him in a loving way. And just, those are the kinds of stories that just tug at your heartstrings, and you're like, wow, what a difference it makes. And there's no medication in the world that would have done that.
No.
None.
We have one patient right now, currently, a current patient, who's nonverbal, does, a lot of moaning, a lot of loud noises, but really not verbal. And I talked to his mom just earlier this week, and I said, how's it going? Because to us, when he comes in, he looks the same. He
Right.
makes the same noises. And she just started to cry. And she said, I can tell this has made such a difference. I said, you can? She said, yeah, maybe not everybody can, but I know him.
Right.
To us, it kind of looks the same. I mean, the maps don't look the same, but anyways, but she said, oh my gosh, it has made such a difference. And so,
Well, don't be surprised. Don't be surprised if that kid becomes verbal. It's happened before with
in our
neurofeedback. So,
office,
seen it.
yep, it's happened in our
Yeah,
office.
I've seen it. So
Yeah.
so it sounds like you have a lot of spectrum cases. Do you have other cases that
Yeah.
come through the
Well, we
office?
see a lot of ADHD. We see a lot of patients that have been diagnosed with anxiety, with depression, with age-related cognitive decline.
We do treat quite a few pans and pandas also.
Oh, really?
Quite a bit of that. Yeah.
Those are hard
Do
cases,
you want to
aren't they?
explain a little bit to the
Yeah.
audience what that is, just so people who maybe aren't familiar?
Hands and pandas, it's when they have a lot of neuroinflammatory changes in the brain, and it can be due to strep or another type of infection, and they don't get the normal symptoms. Like if they get a strep infection, oftentimes they don't get strep throat. Sometimes they have emotional outbursts. It shows up behaviorally, and their brain maps, there are lots of reds and yellows in the magnitude. And I don't know if you've found this, but I found a lot of times with those patients, like the delta waves are the slowest waveforms, so they're the easiest to regulate. So oftentimes we see those normalize first, typically. But in my PANS and PANDAS, instead of healing from bottom up, they heal from top down.
Yeah, so I think in those cases, delta is indicating the inflammatory process that's in their body,
Right.
and that is really hard and challenging to dissipate. So I think that would explain why that's more top down in that way. And I assume you're probably also doing some gut work with them and all kinds of stuff.
Diagnostic Solutions Laboratory is our best friend.
Yeah.
Another common misdiagnosis is ADHD. Kids come in with ADHD. They're being given a stimulant, and we do the map, and it's like, no, this is anxiety. And that's a very, very common misdiagnosis.
Talking about our favorite cases, right?
Mhm.
We had one little boy, and he was diagnosed with ADHD, and he did have it. And he was very impulsive, but he was physically impulsive. Somebody was bothering him, he just haul off and belt them. Right? His mom was like, okay, these notes home from school, I'm getting 3 to 4 notes a week. If you can get these down to 1 to 2 a month, I'll be happy. I think he did 45 sessions total. And by the end, weeks had gone by and he hadn't gotten any notes. He did a testimonial video for us. And I didn't know he was going to say it. His mom didn't know he was going to say it, but he said, before I did neurofeedback, I thought I was a monster because I did bad things and I didn't know why I did it. Neurofeedback changed my life.
And he was like, how
8?
8?
And then it was probably about 3 months after that, his mom called and she's like, you're not going to believe this. I got a note home from school. I'm like, oh my God, you're kidding. She said, Agnes, it was a good note. He got Student of the Month
Oh my
award.
goodness.
What?
Wow, what a turnaround. Was he taking any medications? I don't remember if you said anything about that.
They had tried medication, but I do not think it agreed with him.
Well, probably not
Yeah.
because it was
Okay.
mostly
They had-
anxiety, right?
Right.
I think we typically associate impulsivity with that ADHD type presentation, but it's also a big component of anxiety.
Tell them their emotion brain is not talking to their logic brain. The emotion brain is driving the bus.
Yeah.
And
Yeah,
it's-
the prefrontal cortex is checked out and the amygdala is driving away.
Yeah.
I'm really curious. I love all these clinical stories and whatnot, but I know that you do a lot of training, home training with clients. Can you tell us a little bit about how that's working out?
How many actual in-office units do you have? And then how many on average home training units at a time?
We have 4 stations in office, 5 if you count our mapping station. And then we have 50 home units now.
52, I think.
52.
And we're always on a wait list. We have to use 10 at least.
So I always tell patients, if you want to get that good lasting change, to create that habit, studies show it's about 60 to 80 sessions. People are so busy now. Some moms open up their calendar and I have a panic attack. The thought of them coming to our office 60 to 80 times is,
Yeah.
they're like, I can't do it. So when you came out with the home units, I'm like, oh, this is amazing. So, we usually do 15 sessions in office is a typical treatment plan. So they, know that the neurofeedback is therapeutic and there's benefit to it. We also do in the office photobiomodulation. We use the Vielight unit.
Okay.
Great stuff, right?
Yeah. We do an
Yeah.
oxygen therapy. It's not a hyperbaric chamber. It's the hypoxia, hyperoxia interval training. That machine is made by Ergoflex, and we do PEMF therapy. So depending on their brain map, I might, if it indicates, recommend those other therapies. So they do 15 in office. We remap the brain, and then we send them home with the home unit.
Wow.
And I usually
Wow.
Great strategy.
I recommend that they take it for 12 weeks. It sounds like a long time, but I always tell them, hey, life gets in the way. You're not going to be able to do it every single day. And if you miss a day, there's a little wiggle room there. So
And then if they can't do it in the office, some just can't get here, then we'll do 4 months on the home unit to kind of make up for not being able to do 16 weeks. But I would say probably, no exaggeration, probably 85% of our clients do that, 15 in office, and then go to the home unit.
I love all the cutting edge stuff you're doing in your office. That's great.
Yeah, the home unit too. It's a huge competitive advantage. I know we're seeing the competitive landscape really change in our market, and having those home units is a real, it's a real plus.
Yeah,
it's a real plus.
And the technology, we established right when it was needed the most, right? Because it came out just around when COVID hit and people's offices could not be accessed, and it was able to keep everybody doing neurofeedback, and it's really gone from there.
Yeah. You know what? Interestingly, with COVID, we were allowed to stay open.
Mm-hmm.
And a lot of patients were like, no, I don't want the home unit during that time.
They wanted to get out.
As in a social environment.
Yeah.
You have interaction with people. So
it's a huge part
that was a tough time, boy.
Yes.
Right. And it's also, it's also the way we price it more cost effective. If you're disciplined, it's more cost effective.
Which kind of brings me, I'm shifting gears a little here, but from a financial standpoint, it's pretty nice to have an income producing, revenue stream that doesn't require you to be in the office, going on vacations or taking time off. A lot of chiropractors, they take days off of their clinic. That's money out of their pocket every month. But when you've got a home training system and you're doing home training neurofeedback, that income still is there, even when you're taking a short vacation.
And I always tell them, even though you're training at home, you're not alone. And even if you're on vacation, you can still access their training sessions and you can still look at them.
And we do have our staff, glance at every training session every morning to make sure, and communicate, hey, did you know the lead fell off, or hey, you need more paste, or, whatever. Yeah.
Or some of those little rebellious teenagers that try and figure out a way to pretend they train, but they really don't train. We had one, and I don't know if you know this, but if they take their sensors and stick them in the jar of paste, it will do a recording.
I have never seen that before.
Our kids are very creative.
So it'll look, because I thought, oh my God, this kid was exhausted because all the lines were like, if he were an EKG, he'd be dead. They all flatlined at the bottom. And I'm like, what is going on?
So what does that look like? I did not know that. I know that, and I don't want to give away because I don't want any of the kids hearing this to do this. But if you hold the sensors together, it kind of completes a circuit. So typically it will actually flatline. But I had no idea that if you stick it in the actual paste, that it'll mimic a session.
But a lot of them just go to their room with the laptop and watch Netflix for 30 minutes, but they don't hook up the training, and they assume that they'll get credit for that. So we rat them out. We tell them up front we're going to rat them out. Yeah, absolutely.
That's like pretending to brush your teeth. It's like, all right, I'm going to run the water.
Yeah. Loading the credits ahead of time. Mom and dad are paying for it.
So I tell them all the effort you put into not doing it, and it would have been easier just to do it.
Yeah, exactly. I'd love to circle back a little bit on the family dynamics of neurofeedback and how it affects the family as a whole. Have you seen how it works between siblings and how when somebody goes through neurofeedback training, how it kind of ripples through the rest of the family?
We see it a lot, especially where, the patient that's coming in is having a lot of emotional outbursts, right? They're having that difficulty with, emotional regulation, and they're screaming at their siblings, and they're disrupts the whole household.
Absolutely.
And then the other siblings are like, why isn't he getting in trouble? If I did that, I get in trouble, but he gets a pass, and so it affects the whole family dynamic. And when those, outbursts start to decrease, when that emotional regulation happens and they can actually interact with their siblings in a nice way, it changes the whole family dynamic.
Yeah, I would also imagine it cuts down on the resentment. I mean, when there's somebody who's maybe a little more special in the household and they're getting a different type of attention, maybe the other sibling is feeling a way about, not.
Yeah, I can speak to that personally because it's been a big part of my story. the one son, and who's, both doing much better now. They're adults. We've outgrown a lot of things, but we had some pretty dark years, and it was very difficult on my son with autism. It can even create like a PTSD situation in some of these houses, especially that have, violence. So neurofeedback can help, with that, with the trauma portion for the other child. And like Dr. Agnes said, it really disrupts the whole family dynamic, because that, that the one really kind of sucks all the energy out of the room, and sometimes the other one feels neglected, and then that triggers depression and anxiety. So there's so many different ways. We even take it a step further. I have a deep passion for the caregiver, because I'm gonna start crying, because I've been there, and unless you've been through what I've been through with my kids, you don't understand. You can't possibly understand. So we actually also offer caregiver support groups. We run 4 of them. So while we're getting little Johnny some help on the outbursts, we're working with mom to get her some self-care and support. And we call it hashtag find your tribe. So to help mom find other moms who have kids that have, in fact we have a PANS and PANDAS specific support group, because that's a whole separate animal. And then we have 3 others that are just at different times. One's virtual, one's day, one's evening, blah, 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 blah. But because it does exactly what you said, Dr. Kent, it affects every person in the family dynamic.
I think just in general, people can be very judgmental, and they'll say things like, "Oh, that kid just needs a good spanking." There's no such thing as
those are the parents that cry in our office when they see the report and find out that it really is, that impulsivity really is something that little Johnny can't.
I don't know if you've ever done this, but if you create, the symptom tracker helps us track the progress of the individual. Have you ever created one and allowed the client to fill it out, and then allowed like a spouse or a parent to fill it out? Same questions. And, after a month of filling it out, you see that there's like 2 different perceptions of the progress that was made. Have you noticed
the
that?
Mom's kid and the dad's kid are like different kids.
Different kids.
I should say that because just recently, we're working with a patient, and the mom was filling out the symptom tracker. And then all of a sudden he had a real sharp decrease in all the symptoms. And I'm like, wow, he's doing great, right?
Awesome.
Because I didn't realize. And I'm like, it looks like he's doing, and I showed her the tracker. I said, it looks like he's doing amazing. And she's like, that's where he started taking over the tracker. So even sometimes the way the patient sees it and the way someone sees it, the parent sees it. And
that right there is why so many kids are misdiagnosed with ADHD, because it's a few questionnaires that you send that teachers filling out, and that day maybe Johnny was good and the next day maybe Johnny was bad, or the teacher had a bad day. But you never know. There's no rhyme or reason. Yeah.
And that's what they're basing whether or not you need a prescription medication on.
Yeah. Do you know in the state of Texas, I lobbied for this. This was a few years ago, but there was a bill on the floor wanting to put a psychiatrist in every Texas public school. So, we have school counselors wanting to put a psychiatrist. Let me take it one step further. The bill also said that if the teacher sends Johnny to the psychiatrist because the teacher thinks that Johnny might have ADHD, and the psychiatrist confirms that and recommends medication, if you do not medicate based on that school psychiatrist recommendation, CPS will be involved. Now, this was a bill that did not pass by this much. I mean, almost passed for every public school.
I mean, that's a dystopian society right there.
Well, CPS, if I choose not to medicate and go see Dr. Agnes instead, what? Wait, what?
Yeah.
Almost passed.
Dr. Kaufman, where you said you moved to Texas. Where are you from originally?
I originally grew up in Rhode Island, went to chiropractic college in Illinois, and lived in Ohio for about 20 years, and then Ohio to Texas.
Oh,
no.
You went to Nashville. I did not realize that.
She's a superstar. We did get to talk about neurofeedback in Dubai.
Did you really?
Yeah, last year we went to the International Conference on Autism and Neurodevelopmental Disorders in Dubai. It was really exciting.
Yeah.
Wow.
Got neurofeedback there.
Oh yeah, Dawn.
Did you get to talk there?
Yeah, we were some of the speakers.
Oh wow!
This is great, Agnes. we're going to do public speaking in front of 100 people. I'm like, oh, yeah,
In
my car's running
in
already.
Dubai.
I like the big bottles of
Yeah.
Pharma. Pharma had its own suitcase. We made it through, but it was a great experience. It was great to hear about as frustrated as we are about big pharma and all of that. To hear people from all over the world and what some other countries have just nothing.
Did you actually bring your brain core system to Dubai?
We didn't bring the system, but we brought pictures of the maps and stuff.
Oh, all right.
We have a little little presentation we do. So they call us Lucy and Ethel, but we have a session we do, and it was very well received. It was a good time.
Here's Lucy's rendition of a brain map. Green, good. Red and yellow, bad.
Yeah, keep it simple.
We definitely are polar opposites, which it's really great. And when we both meet with the clients, because obviously she's the brains of the operation, but I'm a mom, and that mom connection is huge. And having previously been a client, to be able to say, hey, I was in your chair, but then also understand the business side and how it all works. It's a great it's a great company.
I think Russell's like that for us. Our partner Russell, he had a personal experience with neurofeedback, and when he talks about it, it comes right from his heart. And I feel that you're very much the same, Dawn. It's like you can feel how it changed your life, and who doesn't want to hitch themselves to that wagon and say, I want to feel that way
when
too.
She said create a position for me, it was a no-brainer. I mean, who would want someone like that to be part of their team?
What an advocate.
Doing a lot of advocacy work because I was mad as a hornet that no one ever told me about neurofeedback. Even if insurance doesn't cover it, whose job was it to let me know that this was an option for my kids where I didn't have to medicate? And I mean, I was mad. I ended up on the national news and newspapers and podcasts. I was all over the place. So telling the story, it was indirectly already sending a lot of business to Sandstone, just telling our story. So I was like, man, I'm sending you this business. Imagine what I could do if you put me on the payroll. So because we test for hearing, we test for vision, we test for all of these things, but I just don't understand why, especially for minors where their brains are still developing, why these non-invasive, testing and treatment methods are not mandatory. Like we're not required to try them on our little bitty baby brains. And then if they don't work, maybe medication is the last resort. But I mean, I really struggle with that. I really struggle with the mom guilt. It was very, very difficult for me. And I wanted to know whose job it was to tell me that this was a thing.
I want to speak for Guy and myself and Russell. I think it's partly on us to get that word out and let people know, neurofeedback, unlike the pharmaceutical companies and, the medical profession, we're not organized that way where, it's just a clear and concise message that says, hey, let's try non-invasive first. And there is an alternative to doing these medications before we go to that extreme. And I think we need to take that on, really. And I think that's part of what this podcast is about too. It's just, is letting the world know that there is an option, there are alternatives, and there's a way to, to change people's lives without having to do invasive things.
I've met with quite a few legislators on the state level. And what they tell me, of course, is that, in like trying to get it covered, by insurance, for example, because obviously that would open up a lot of eyes and make it much more forefront. They tell me, they won't do it because they don't want to take on big pharma, of course, right? Nobody wants to be a legislator that takes on big pharma. And so, I've had conversations with them about, what this parity law that exists. Really every neurofeedback insurance claim that's denied is a violation of the parity law. So I always say, look, okay, if you don't want to be the guy that, writes the bill to try and put this in the forefront, make it more available to more people, how about you just be the guy that enforces the laws that already exist? Because, that parity law says if you cover something for a medical condition, if you're an insurance provider, and you cover it for a medical condition, you must also cover it for a mental health condition. So all of the companies that cover biofeedback for, incontinence and migraines and all these other things, they're required. And you can go on the parity violation website, it is one right after another, but they would rather pay the fines than, upset big pharma.
Yeah. Well, I mean, I have conflicting feelings about that whole insurance model, only because I
Oh,
hear what you're saying, that it opens it up to a lot of people, but I also find that when there's oversight in that arena, it's quite limiting, and we
I
don't want to limit. I think this really should be in the hands of everybody. Should have an opportunity to do neurofeedback for any number of reasons, and if people start thinking it as only an insurance based intervention, it will limit that growth, and I don't want to limit
yeah.
that growth.
And I didn't mean that. I just meant from a visibility standpoint. I
Right.
think that's a big
Right.
reason why the visibility is
Yeah,
not
yeah.
there. That was the only point I was making. Oh, no, I'm not a fan of that. I've talked to legislators about it, but if they approved it tomorrow, I don't think we would take
Right.
it for that reason, right?
Yeah.
Exactly.
And I love the idea that you guys discussed regarding, try this first before you try a more invasive approach, and when I hear that, it reckons back to chiropractic again for me, because that's our philosophy, right? And, hey, don't go get a back surgery until you've tried chiropractic, don't get injections until you tried chiropractic. It's the same principle, and it's just being applied to neurofeedback now. It just makes sense. It's just common sense.
Yeah. And I think the medical model is starting to change, and they're going to more of the, so like the individual insurance companies. Like we have a hospital here, it's called Kelsey-Seybold, and they have a whole host of providers. And so you buy their plan and you get to see all of their providers. And in those models, I think you're going to see chiropractic be a major gatekeeper, because oftentimes you don't need, the injection, you don't need the surgery, and those cost savings are really going to shine.
Yeah, it's you see little glimpses, right, of change. I mean, look, we've been, I just hit my 30th anniversary of being a chiropractor, and the world's changed a lot in 30 years, that I've noticed. So, and it, mostly in good ways.
I often say neurofeedback today is like chiropractic was back in the maybe 70s or 80s. You go out on the street today and you ask somebody, hey, what's neurofeedback? 9 out of 10 people aren't going to have any idea what it is. And if you did that back in the 70s with chiropractic, it would have been the same thing. People that I don't know what chiropractic is, but now you ask someone what a chiropractor is, they know exactly what it is. I kind of feel like neurofeedback is going to kind of follow in those footsteps.
Yes.
I think it's gaining momentum, though. I mean, when I officially came on board as an employee, 4 years ago, we were one of the only games in town, and we're not anymore.
And the other thing we have to be cognizant of and be weary of is the fact that as neurofeedback is gaining more momentum, you're going to have companies that are pretty, unscrupulous, and they're going to make claims that aren't true. They're promoting what they're doing as neurofeedback, and it's not neurofeedback. In some instances, they're zapping the brain with electricity. In some other instances, they're doing, entrainment therapy, and they're passing it off as neurofeedback. And that's dangerous, because people are going to get the wrong idea of what it is that we do. Make sure it's got 60 years of university-based research showing its efficacy, because that's what we have, and there's so many new companies out there right now that there's no research at all, or if there is, it's minimal, with no control groups, and it's really sad that that these companies would take advantage of the general public that way.
There's always a shiny new toy, and here, buy my shiny new toy. It's better than what you have, but
on the other hand, it also, on the positive end, it helps normalize, the term neurofeedback. You know what I'm saying? I mean, there's more people doing it, talking about it, and that's a good thing for us.
Yes.
More competition is better, honestly.
I was going to say, the one thing that I would be careful of, though, if I was a consumer out there and you were looking into different neurofeedback, I'd be really leery of whatever neurofeedback device is saying to you that they're going to zap your brain with electricity. I would be cautious of that. I know I would never let anyone put electrical signals into my brain. Neurofeedback doesn't do that. Neurofeedback, as we know, is a learning modality, right? Exactly. You're teaching the brain how to regulate itself. It's completely natural. Nothing goes into your brain. But now we've got these companies out there, talking about, oh yeah, we'll put a little current in your brain and just kind of give it a kickstart. Well, that's not neurofeedback. And in some cases, I think that sounds dangerous to me.
It does. And the scary thing is, it's like a 4-hour certification program to have that. I mean, you're not zapping my kid's brain with 4 hours of training.
Yeah,
Everything
exactly.
that her doing, she's got hundreds of hours,
Yeah.
right?
I'm with you.
Yeah.
Exactly.
Yeah. And what I was going to say is just that one of the things, I guess, the natural ramifications of being so successful as you are is that you are going to find other people in the community wanting to, kind of latch on and start doing something that, some similar type of thing that you're doing. And that's why you'll start seeing more people advertising neurofeedback in your area, because you're being so successful and changing so many lives in the community. Other people want to, they want a part of that.
Dr. Agnes and Dawn, thank you so much for being on this podcast. I am sure that you are going to be changing a lot of people's lives. Just the people listening to this podcast are going to be affected just the way you're affecting your whole community. And we're so happy to have you as part of the BrainCore family. And thank you very much for being here.
We're happy to be here. We'll see you in a couple
Yeah,
weeks.
we'll see you at the symposium.
Yeah, we'll see you
Can't
at the
wait.
symposium.
Weeks.
Yep.
All right. Take care.
Okay.
Take care.
Much.
See ya.
Bye, people. Thank you.